it's not constitutional, then we're going to need to have an answer. You know, we're going to have to move forward because one thing everyone agrees on is that the current system is not working. Now, look, I mean, you'd be hard-pressed to find a panacea looking for solutions on how best to approach healthcare. My sense is that it's going to include insurance reform. It's going to include liability reform, sometimes called tort reform. But I also think it's going to include ways that we provide healthcare. Transformation on that level. We actually have some pilot program going on in our area, Hudson Headwaters, Adirondack Medical Complex, involved in the medical home. The medical home project targets readmission rates in hospitals, which is among the reasons that we've seen a spike in healthcare costs. It provides some investment on the front end in terms of following up with nurses and healthcare professionals to make sure that before folks are discharged, they show competency in understanding how to take their medications, sequence, and when they're going to take them, and any other stipulations that go with their discharge. And then after they're discharged, generally the first day or two, they have a healthcare professional go to their home and ensure that there's a capability that they're following their guidelines and their prescriptions. And then even there after that, there are phone calls that follow up. What they found in this pilot is that they have cut significantly. I think some figures show cut in half readmission rates. And if this holds to be true, this is going to be very significant going forward. So that is the approach that I support right now, is insurance reform, liability reform, transforming the way that we provide health care, and recognizing the technological breakthroughs that come through. We've got to reconcile our need for privacy with the need to have online medical records. And I think we can do it. My experience with biometrics, I think that you can activate your file either with iris or a fingerprint, and you would have that assurances of privacy. And you would allow for any kind of emergency situation. If you were in a different location, you would have the ability to have your records with you. I went through that this summer. I had a situation where I had a filling fallout. And the first thing the dentist said is, well, we're going to take an x-ray. I just had an x-ray. I just had an x-ray two weeks earlier. It was needless spending. You know, I happened to be in a different geographic location, but it just struck me that we've got to be able to get our arms around this. And I think that'll help drive down costs. You know, with regard to universal, I think they're going to have a state that's going to try it.
You know, and I don't know, you know, I say universal as just some kind of coverage, but I do know, just like from the village's perspective, we just made a decision not to add back an employee. Yeah. And part of the decision was made not because we couldn't pay the employee, but when you add in health care, when you add in disability, when you add all these other things, now you're saying we may be better served to help our people that are here a little bit more, to have a little bit better way of life and not incur all these other costs. Can we do it with less? So we're affecting the employment rate by doing that.
Well, indeed, and that's why I'm saying that we need to find ways to bend down the cost curve. That's something that's pretty widely agreed upon. The question is, how do we do it? I would maintain to you that the bill that we tried about 18 months ago, 2 years ago, even with good intentions, we ended up with spiking premiums, more taxes, more regulation, and more big government at a time that I think we should be consolidating. You know, there's probably going to be some object lessons learned in terms of executives too, because when you express a goal and then the law doesn't match the goal, you get frustrated. So I wonder how much that the administration may have been influenced by the read of history from 1993, you know, in 1994. I wonder if the lesson learned there was, well, if the White House is so heavily involved, that may frustrate the ability to get through Congress. So I wonder if the Obama administration, getting that read of the Clinton experience, decided to let Congress be the major writer of the bill, but then having all the inputs that were brought to bear and having it not reflect I think in some respects, what the initial outset, what the goals were. So, again, we'll have a Supreme Court decision this year, and I think it'll be very influential on this whole debate going forward. And so I'm of the mind that I think the best way forward is insurance reform, tort reform, technological breakthrough, and the way we provide care. But I understand the state's going to try and experiment. So, you know, we'll see what happens with that.
Thank you, and I'm going to apologize, but I'm going to step out as well because I've been asked to.